Greetings and welcome. The Health Studies Collegium Foundation. Restore Health. 5 key success strategies. My name is Russell Jaffe. I'm a physician and internist as well as biochemist. I'm a certified clinical nutritionist, and I maintain a fellow status as a clinical pathologist, a clinical nutritionist, an allergist, immunologist, and I'm a member of a number of academic, national, and international societies. I'm a senior fellow of the Health Studies Collegium and founder and chairman of PERC Integrative Health, ELISA Act Biotechnologies, and RMJHRX. What's more important for today is that over the last decades, we have been able to synthesize what we want to share with you over the next few minutes in Restoring Health, 5 keys to success. And these 5 are: first, immune system insight, finding the illness triggers; second, identify health concerns and needs by a HAQ, Health Appraisal Questionnaire; then personalize safer, more effective supplements; and get enough of the good stuff in and the bad stuff out. So enhanced nutritional competence and reduced toxic burden. And putting this together as the alkaline way, because what we eat, drink, think, and do either heals or harms. So with each choice, with each meal, with each action, with each thought, with each activity, we're either promoting or reducing our health and vitality. Over the last decades, it's been my privilege to synthesize 5 key strategies that in practice we call WellGuard, the WellGuard 5. And what are the WellGuard 5? Well, they're LRA by ELISA Act tests to identify immune-damaging foods and chemical sensitivities. There's a health appraisal questionnaire to personalize needs for nutrition and mindful activities. That's the HAQ. Then there's enhanced ability to remove excess and damaging toxins. Then the ability to restore and rebuild personal, safer supplementation being a core. And then the alkaline way, a lifestyle to fully meet individual needs. So, strategy number 1. Functional immunology. Understanding the immune system through functional tests that are more predictive, sensitive, reliable, and meaningful. And with regard to immune tolerance tests, lymphocyte response assays are recommended, specifically HSLRA, the high sensitivity lymphocyte response assays, those with less than 5% variance, qualifying as high sensitivity, and the lesser the variance, the more predictive the information. With regard to your immune system, it is what defends, repairs, and deletes. Now, we're familiar with the immune system doing defense work. We may even be familiar with the immune system as responsible for repair from daily wear and tear and to keep us going in our digestive interactions, in our neurohormonal balance, in our ability to defend and repair ourselves. But the immune system is also responsible for identifying, marking, and deleting any abnormal cells, because most people make cancer cells every day, and we want to get rid of them. Now, what about the immune system itself, the IDRS, Immune Defense and Repair System? IDRS is just the first letters of 4 words, Immune Defense and Repair System, and we want people to understand that the immune system does repair and defend us, but doing defense first, because that's the priority, and then repairing as it's able to do it. So the human immune system has an innate part. That's the part that's with us all the time from birth on. That's to repair, to delete cancerous cells, to recycle anything abnormal. And when needed, the immune system calls upon an adaptive response. It calls upon a defense and repair capacity and competence that is held back because it's so costly in terms of essential nutrients and so costly in terms of energetics. But like running a marathon, it's a good thing if you can, and you should do what within your capacities you're allowed to do to rebuild, to defend, to repair. All too often, the immune system is overburdened. An overburdened immune system has hidden, delayed, or what they sometimes call mystery or occult hypersensitivities, things that come and go, or get up and go, got up and went, and we're not quite sure how to get it back. The overburdened immune system we can look at in terms of the different delayed pathways, why there are several of them, why this is so important to survival as well as to being well, and what to do to choose to be well rather than enable ill health. Here we want to start with the immune defense and repair system, both innate and acquired. The innate is the part you see on the left. We're born with this. It's to repair and recycle. It's our innate immune system. Notice that these cells are quick to respond and live a short time. So the phagocytes and dendritic cells tend to live about half a day. They're very energy intensive, but energy requiring. They're our first line to engulf and recycle anything foreign. Then on the right side of the slide, we see that if needed for defense, an adaptive immunity is available through native B cells to produce antibodies that could be neutralizing and beneficial, or, could be harmful and complement fixing. And then there are the T cell responses, which turn out to be even more important than the B cell. The T cell non-antibody requiring responses that are directly cell mediated with effector T cells, the helper and suppressor, and the naive programmable T cells. These effector T cells, notice over days and sometimes over weeks before the response is noted. So let's review quickly this acquired adaptive immune response. Here it is either naive B cells that get programmed, sometimes as plasma cell antibody factories, and when we're healthier, these antibodies are beneficial, neutralizing, and protective. But when we're in times of distress, when we're under more defense than repair states, those antibodies can be complement fixing and harmful. And then the even more important T cell responses, where the cells respond directly, the lymphocyte white blood cells respond directly as effector T cells over days, and then it takes sometimes days to weeks before we feel the symptoms. So the acquired adaptive delayed immune responses are challenging to understand. The best of history is not sufficient, but there are ways to get the immune system to talk to us under the controlled conditions of the laboratory. So with regard to the innate immune system, it includes the skin, which is more than a wrapper for the body. It includes the nose and mouth and lungs. More than just passive gas exchange goes on in the lungs. It includes the GI tract and a whole host of microbiomes that repair us, that help protect us from cancer, that are our innate anti-cancer mechanisms, and we are repaired and our anti-cancer mechanism work as they're able. If there's too much defense going on, then repair and anti-cancer deletion are deferred. So the innate immune system is there to eliminate foreign invaders before they get in, or to recycle them immediately upon getting in, and if any of them escape, then we call upon the adaptive, the acquired immune responses. And this is a slide just to show how elegantly complex it is from an antigen that is processed through an APC, an antigen-presenting cell in the middle on the left, and then, depending on the conditions, you either upregulate by going to the upper left, the Th0CD4 plus cells that become Th2CD4 cells under the influence of interleukin 2 and 4, and these B cells can become plasma cells that produce antibodies, or just memory B cells waiting to produce a humoral antibody functional response. But the same upregulation can go in the direction of Th1, which is what we see on the bottom, the memory T cells that respond directly, especially under influence of IL-2, and other counterbalancing cellular response mechanisms. Now, natural killer cell and viral infected cells are anathema to each other. The blue colorized left-seeing natural killer cell is about to attack and delete the virus transfected cell on the right, and that's a good thing for the body. T and B cell responses vary considerably over time. If we look at the first exposure on the far lower left, antibody and effector T cells come up within a matter of a week or so, and then they quiet down. Then there's a period of inapparent reinfection if the body is primed. And then on the far right, we see that over a long period of time, typically years, there is a persisting low-level awareness that when exposure happens again, causes an upregulation or a remembering of these immune responses. So the body can have a kind of quiet state and then have what's called a memory response or an anamnestic response when it sees the antigen again. Now, the adaptive immune system starts in the bone marrow, and we see here the lymphocytes that come out of the bone marrow on the top, and we see the general defense, what we call feeding cells, that is the macrophages, granulocytes, monocytes, those wonderfully wiggly cells that have recycling centers within them on the bottom. So the bone marrow produces both the lymphocytes in a measured way and the general defense feeding cells, the granulocytes, the monocytes, macrophages, etc. These are revved up by the complement system. The lymphocytes process through the thymus, as we see in the upper half, or through the intestinal tissues, such as the lining of the GI tract, including the liver and spleen, which are really part of the overall digestive and detoxification systems. Then B lymphocytes are activated, suppressor cells called in, plasma cells produce antibodies that can be helpful or harmful. T cells have long memory and respond directly without antibodies. And then, of course, there are the quality control cells, the natural killer cells, that delete any abnormal cells when they form. So let's review briefly what happens in the usual situation is that there's a cell-mediated T cell response. These are more important. These T cells migrate to lymph nodes, and then if an antigen comes by, a memory T cell, a cytotoxic T cell, an activating helper T cell is produced, and this is what we call cell-mediated immunity. This can interact with, this can be adaptive in response to the antibodies, the B cells that migrate to lymph nodes as well. Then, under antigen stimulation, the B cells can become plasma cell antibody factories or memory B cells that respond. Here we see the innate and adaptive cells in the immune system and their overlap. You see on the left side of the slide these many wiggling, dendritic, granulocytic, recycling cells. You see on the far right the T cells and B cells, and then in between the natural killer cells and cytotoxic T cells that are responsible for cellular quality control. All three aspects of innate, acquired, adaptive, and deletion are, as reviewed here, slightly modified from Nature Reviews, our current understanding of immune defense and repair systems. A healthy immune system means no allergies. A healthy immune system means we're tolerant to the world and we don't have any delayed responses. A healthy immune system means we can neutralize infections and allergens without any symptoms, and a healthy immune system means we're able to defend and repair from daily wear and tear because the 50 billion dendritic cells can recycle 50 foreign pathogens or 50 foreign items themselves, and when they're energetic enough, when they're not gummed up by toxins, they do a terrific job. Now, hidden immune burdens, these are the delayed hypersensitivities, the delayed allergies. These are hard to find. Delayed hypersensitivities and delayed allergies have symptoms that occur 3 hours to 3 weeks after exposure. So the symptoms can even be nonspecific, kind of like getting the flu over and over again, being susceptible to what goes on without knowing what it is that's provoking the problem. The reactors, in essence, drain vitality. People are chronically unwell. They're get up and go, got up and went, and they don't know how to find it. Now, what delayed hypersensitivity testing now allows is true ex vivo lymphocyte response assays. HSLRAs with less than 3% variance. That means very high reproducibility and a high degree of confidence that what is found is either truly reactive or a cross-reaction that's significant, and that by enhancing immune defense and repair systems in both the digestive tract and in the metabolism, by avoiding exposures and enhancing rebuilding systems, you can get the most out of these ex vivo HSLRA tests, such as LRA by ELISA ACT. Then there's delayed hypersensitivity that's in vitro, antibody serology tests such as IgG. However elegant, they are static, physical chemistry, and really misleading. And misleading because they don't distinguish helpful from harmful antibodies, and that's a big problem. Because if an antibody can be helpful, but the same class or type of antibody can be harmful, and all you're telling me is whether there's an antibody, but not whether it's a good guy neutralizing antibody or a bad guy, a harmful complement fixing antibody, that's really confusing and misleading. And then it turns out, as we've emphasized, the T cells which respond without antibodies are even more important in delayed hypersensitivity. So just looking at IgG is really looking through the rearview mirror and trying to drive a clinical best outcome result. Particle size tests are out there. They can be random and misleading. There are cytokine release technologies. These are interesting, but for the future, they haven't been proven in clinical outcome studies, as have the ex vivo LRA by ELISA ACT tests. So delayed hypersensitivity antibody or serology tests, such as ELISA or ERA IgG, IgG4, IgA, IgM, they quantify antibodies, but good from bad cannot be distinguished. This gives you a long list to avoid with many false positives and false negatives. False positives because neutralizing antibodies don't need, and substances don't need to be avoided. And false negatives because you don't get the T cell responses that are as or more important in most cases than the B cell antibody responses. And particle size tests, well, frankly, they don't reproduce themselves very well, as the literature has said. And if you can't reproduce yourself, if you're producing fairly random numbers, there's not a lot of clinical predictive value in such particle size tests. But true lymphocyte response assays, HSLRA with less than 3% variance on results, HSLRA by ELISA ACT method, directly observes the lymphocytes under conditions similar to what goes in the body. It's an ex vivo test. That's better than an in vitro test tube test. It measures all 3 delayed pathways concurrently. It's an advanced method with few false positives. And if there's digestive intolerance, if there's weak digestion, that can be easily detected and incorporated into the overall health plan. Here you see on the left non-reactive lymphocytes, looks kind of like Starry Night, and on the right, reactive lymphocytes. It's easy to tell the difference between reactive and non-reactive lymphocytes when you look directly under the microscope using highly purified antigens in a novel microtiter plate and in a system that allows the cells to react ex vivo just as they do inside the body. So we want an HSLRA, we want one that's comprehensive, functional, and ex vivo. We want one that measures all 3 delayed pathways and gives us the useful clinical information about what to substitute, and then when combined with an HAQ, how to have a best outcome clinical personalized approach. So hypersensitivity or allergy tests come in immediate kinds, the type 1, the acute RAST IgE histaminic kind, and then the delayed allergies, the type 2, 3, and 4, the reactive antibodies, the B cells, the immune complex, those that cause vasculitis and other immune complex disorders, and then the type 4 T cell mediated responses. Now, delayed hidden allergies are hard to identify by history or serology. They are identifiable by LRA tests, and especially an ex vivo LRA by ELISA ACT with very high reproducibility and precision. So just to briefly review, acute allergy, type 1, IgE, that means the kinds that cause runny eyes, hidden itching, sudden itching, hives, swellings, anaphylactic reactions, anaphylaxis. These are histamine-mediated and measurable by either conventional allergy skin tests or by RAST in vitro lab test. These are different from delayed. These are the acute. These are the reactions that happen within seconds to minutes, and where a good history usually is sufficient to identify the trigger or the cause. EpiPens, for example, are helpful in type 1 immediate hypersensitivity. But here we're really focusing on lymphocyte response assays, these amplified advanced cell culture tests, where with a small ex vivo sample, we can do more than 500 cell cultures, looking at a wide variety of foods, food additives and preservatives, environmental chemicals, toxic minerals, medications, molds, danders, hair and feathers and herbs, in essence, everything that people get exposed to, so that we can do a comprehensive assessment of all delayed hypersensitivity pathways at a single time. Now, the HSLRA Immune Enhancement Program involves substituting for reactive substances for 6 months in the case of strong and 3 months in the case of moderate reactors, then correcting nutritional deficits that reduce defense and repair abilities, and initiating, enhancing, enabling detoxification mechanisms by phase 1, 2, and 3, and alkalinizing or mineralizing the cells to enhance human healing responses and to enhance the energetics of cells. The HAQ Health Appraisal Questionnaire is a personalized recommendation set based on information the individual provides, and from that, individualized safer supplements, activity and environmental recommendations, mental and mindfulness activities are also recommended, and if requested, a rotation diet is an option. Now, Joy in Living the Alkaline Way is a guide that synthesizes the information that individuals use in this personalized approach to HSLRA tests and treatment guidance. And the Alkaline Way brings healthy balance in the following ways: alkalinizing foods and water, an activity and first AM urine testing to make sure we have enough of the beneficial magnesium whose uptake and chaperone delivery is enhanced by choline citrate, then abdominal breathing, green light, and sunlight. Eating in harmony with our nature and lifestyle, substituting for immunotoxic foods, and eating foods that are locally grown, vine-ripened, organic, or biodynamically derived as much as possible, making restorative sleep a priority, and working our muscles and relaxing in balance and in proportion. You notice on the bottom of many of these slides a reference to chapters or reviews that we've been invited to contribute, and you're welcome to look for the details in those references. Now, here's an example of a success with migraine headaches. The person says, I've not had any migraines since I started on the LRA by ELISA ACT program after having them for 20 years. Great to be free of them. Indeed, Egger and colleagues have shown that 88% of migraines are due to delayed food allergies, and we suggest that with more comprehensive ex vivo testing, even better results can be achieved. What about chronic illness in general? Here's someone from Dr. Norm Schwartz's practice in Milwaukee who says, I found the LRA by ELISA ACT to be the most reliable and effective solution to solving my patients' chronic health conditions. That's from a colleague and a friend. Clinical successes led to a fixed treatment guideline that was designed to test whether this really worked in outcome studies. And in these clinical outcome studies, people were asked to substitute for the LRA reactive substances to correct nutritional deficits that reduce defense and repair abilities, to initiate detoxification mechanisms that remove environmental or xenotoxins, and to concentrate on evoking healing responses both physically and mentally. And to look very quickly at some of the outcome and impressive results. In the Journal of Musculoskeletal Pain, we published this novel treatment of fibromyalgia improves outcomes in a community-based study, people doing the best they could, in just 6 months. More than 50% less pain, more than 70% less depression, more than 50% enhancement in energy, more than 30% less stiffness, and we've continued to monitor this population, and they continue to function better at low cost of care. Here's a case-controlled study data point, just looking at overall health scores. We normalized the data so everyone was at 100% to begin with. At 3 months, notice that all 3 groups are better. But at 6 months, notice that the control group has fallen back. That is the group on the left. The intermediate, the turquoise or green group, is the primary fibromyalgia, and they're better. And then those that had complicated cases improved even more because they were coming off a lower starting point. Here's another successful outcome study, this time successful diabetes studies, 2 of them. We looked at type 1 diabetes and type 2 diabetes. And we've published in the peer-reviewed literature a more than 1 milligram per deciliter decrease in hemoglobin A1C in both type 2 and in type 1 diabetics. And in type 2, in the adult diabetics, the 90% that's most common, there was an 18% reduction in insulin levels in just 6 months, which means an improvement in insulin function, a decrease in metabolic syndrome, a decrease in insulin resistance, an improvement in metabolic status. Now, with over 70,000 cases and over 30 years of experience, we believe this is the standard by which delayed allergies and outcomes can be measured. If we look at some of the data from the 2 different studies, one in type 1 and one in type 2 diabetes, you see a similar, about 1 in 4 people had reactions to sweeteners. Toxic minerals were more common by far in type 1 diabetics. Environmental chemicals dominated, but were common in both type 1 and type 2 diabetics. Food additives were much more common, almost twice as common in type 1 than type 2 diabetics. But cow dairy, interestingly, was more than twice as common in type 2 than in type 1 diabetics. So we see individuality is most important, and that's why the LRA by ELISA Act is the way to find out what is burdening an individual's immune defense and repair system. So 5 keys to restore health: the WellGuard program, LRA test to identify immune-damaging food and chemical sensitivities, a health assessment HAQ questionnaire, removing excess toxins and damaging environmental burdens, restoring and rebuilding through targeted supplementation to meet individual needs, and bringing it together in the joy in living the alkaline way, a way of being, a way of eating and drinking, thinking and doing that enhances health and reduces risk. To open an account, please call 1-800-553-5472 or visit www.elisa.com/new-account-set-up-form/. Now, if you already have an account with PERC or with ELISAC Biotechnologies, let your account specialist know you want to offer the WellGuard program. On behalf of Health Studies Collegium, I'm Russ Jaffe. It's a pleasure to bring this information forward so that we can all be well and happy.